Welcome to Austin Eras, where we explore Austin's transformation into a 21st century boomtown and the voices shaping its past, present, and future.
Welcome to the Austin Eras podcast. I'm your host, Adam Flagg, and I'm here with our guest today, Dr. Clay Johnston. Welcome to the show.
Thank you very much.
I'd love to tell our listeners a little bit about you. You're a neurologist, epidemiologist, a healthcare disruptor who spent his career at the intersection of medicine, academia, and innovation. You've earned degrees from Amherst, physics degree, interesting. Harvard, you got your MD, UC Berkeley, a PhD in epidemiology, and became a nationally recognized expert in stroke care. You served as the Associate Vice Chancellor of Research at UCSF and was the founding director of the Center for Healthcare Value. In 2014, Clay moved to Austin, Texas to become the inaugural dean of the Dell Medical School at UT, helping launch a bold new vision for medical education and care delivery. In 2021, Clay co-founded Harbor Health and serves as the chief medical officer. Harbor is really interesting. It's like a clinic and an insurance company combined together, rolled into one. We're going to talk a lot about that as we go along. The goal is to redesign the healthcare system and provide outcomes and relationships over transactions. Harbor has now raised over $250 million and operate more than 40 clinics, rapidly expanding around Texas. Outside of work, Clay enjoys morning runs, traveling with his wife Clarissa and 2 sons, as well as sampling the occasional Texas barbecue. Welcome to the show.
Thank you. Yeah, great to be here.
I'm excited. I think when we've met a few medical professionals here, but really the idea of going from medical practice to academia to research to disruption is an incredible journey. And I think our listeners are going to be excited to kind of go through this with you. So I think this all must have started well into your childhood because as I did my research, I read that you come from a family of doctors, a father, grandfather, uncle, and older brother. Tell me about the legacy of what that looked like and why that became the family profession for you.
Yeah. Well, I think maybe because it was a family profession, I avoided it or tried to avoid it for as long as I could. So I actually didn't get my pre-med stuff done until after I graduated, did undergraduate degree. But yeah, I mean, I think seeing what the profession meant to my dad, my grandfather in particular. I could see, just how important it was to them, and they defined it, and it defined them. They were very sort of caring people who really built their whole lives on principles, and that really resonated with me.
That's wonderful, and I know one thing that I think really stood out to me as I read about you and your background is you and your wife Clarissa adopted 2 sons from Guatemala. And I thought that was really interesting. Guatemala is Central American country that usually is not one of the weakest economic economies there. Tell me about kind of what reflected on your decision to kind of go into the adoption route.
Yeah. So my wife had spent some time in Nicaragua and on kind of medical trips and trips to work on infrastructure. And so she had she loved the region and the people, and recognized that there were needs there. It's that wasn't the sole reason that we adopted. We adopted because we wanted children too, and so that was even more important. But it opened us up to the notion of looking internationally as opposed to just nationally, and that's been awesome. It's great. I mean, having kids is awesome, and it definitely changes you in fundamental ways that make you less selfish. And so to not have been able to experience that and the growth that comes with it would have been a real miss. And just watching those boys grow up and thrive has been just awesome.
Are they teenagers now?
They are, let's see, no. Both of them are now in their 20s.
Oh my gosh.
Yeah, so the youngest just turned 21 and the older is 23.
Are they sticking around Austin or no?
One is here in Austin. He's just graduated from Texas A&M, and he's going to go to flight school. And the second one is at Colorado State.
Okay.
And I'm not... I'm not sure whether he'll come back. Well, he'll be back later today for Thanksgiving.
Okay. Well, Fort Collins is a great city. I can't blame him.
Yeah, it's a great city.
One thing I noticed about your work life and your academic life is you spent a lot of time in the Northeast. You spent some time on the West Coast. And I think you had an illustrious career in medicine, obviously, and you still do. When did you realize you wanted to focus your career more on leadership in medicine?
Yeah, I didn't start out saying, "Hey, I want to be a leader in medicine." That was never really my intent. It was more just the frustration with the way the system was working. So the reality is we've got in medicine, particularly in academic medicine, you're taught to focus, and so people are just down these little rabbit holes working on XYZ, this protein or that cell or this clinical question or whatever it is. And so there are very few people that are taking a different view to say, well, is that the right rabbit hole? Do we dig correctly? Are we using our resources appropriately across all these systems? Very few people were doing that. So first, that got me into asking questions about whether the way we do research makes sense. Mm-hmm. Is that it takes a long time to move things forward in research and a lot of money. And my questions were like, well, why does it have to be that way? Can we create a better research system? And so was when I first kind of rose up into leadership positions. I was already running the stroke service at that point, but that's relatively modest. But then, when I started to take responsibility for the translational mission of UCSF, University of California, San Francisco, that was a much bigger leadership position.
So I'd heard that you were at UCSF and you had someone you worked with academically come to Austin and start to look at the Dell Medical School. You moved here in 2014. I'd be curious about had you visited much before you got here? I know you had kind of a Germany, Birmingham, Denver, along with the other places I've mentioned. You've been all over. Your father was in the military, is that right?
Well, that's why I was born in Germany. But no, he's an academic pediatrician, and he just moved around with different promotions. So yeah, we lived in all over the place growing up, mostly Denver towards the end. And no, I did not visit. I hadn't been to Austin. I'd been to Houston, Dallas, El Paso. I'd been to kind of all the other San Antonio, but I'd never been to Austin before I came to interview for the job.
Okay, so that's 2014. You get here, or maybe 2013, depending on when you arrived.
Yep, it was September, maybe October 2013.
So what were your impressions? I'm curious now that you've been here for 11 years. What were your impressions when you first got here, and what do people on the coast potentially, what do they overlook about Austin? Yeah,
I mean, I knew Austin was an interesting and vibrant place. I already knew that. The fact that I hadn't been here wasn't on purpose. It was just that, the convention center is not as big as the convention centers in those other places,
sure.
El Paso being the exception. But so I just never had been brought here before. I mean, my first impression really was, I arrived at night in prep for a group interview, which had, I think, is probably like 16 people around the table, and it was at a hotel. I was staying at a different hotel, and I woke up early that morning, and it was still dark. I had to go out early because my interview was early, and ran around the lake, and this again, it was like late September, early October, and
so still 90 degrees.
And the reality was, I had a great run, but I couldn't believe how hot it was.
Exactly.
And it was great to have that beautiful trail down there, and that taught me something about Austin and investing and things like that. It wasn't completely finished at that point, but there was enough signage and stuff you could figure out exactly where you should go, and so that part was awesome. But then I went back, showered, took a cold shower, got my suit on, and I was still sweating when I arrived for my interview, which was, a good hour after I had run. So that taught me, some of the pluses and minuses of Austin.
You learned in the first 24 hours.
I learned in the first 24 hours. But, I think coming from San Francisco at that point, I knew San Francisco, all these places that, New York, Boston, San Francisco that I've lived, they all think they're the center of the world, those three places in particular.
Uh-huh.
I mean, DC does as well. And,
Clearly.
And yet I have always recognized the provincialism of those views. I think from just living in so many different places, and there are always pluses and minuses of all these places, and it's just whether you explore and elevate the pluses and ignore the minuses. And so Austin has a lot of the same pluses as San Francisco. It's missing some. It doesn't have the cultural richness in terms of the kind of art scene, that kind of thing. Different cultural richness in terms of music and all of that, but has some cultural richness is very similar. Different kinds of food, but has that. But also where San Francisco is a little bit, it's always chilly, and it always is to the way it feels, the way people interact and all of that. It's a little more transient, harder for families, and Austin solves those problems, right? So our boys were pretty young then, and this was a great elevation for them. They could, ride their bikes on the streets and walk over to friends' houses, and things that were just a bit harder in San Francisco. They didn't have to compete to get into school, all those things that were a hassle there. So that was an important realization.
Yeah. Well, I mean, getting the first of anything. I want to talk about the Dell Medical School. Being the first anywhere is such a groundbreaking, important thing. You came on board in 2014, and then the school actually launched officially in 2016. So tell me a little bit about the challenges of kind of getting things off the ground, as well as the highs of what that looked like, because you spent 7 years in that role, right?
Yeah. 7.5 years in that role. So it was such a great experience, a great honor to be able to do that. What is it? Why it was so important for me is just that it gave us a notion about how to rethink the whole system. Things that I was butting up against. Yeah. We didn't have many of the barriers that exist for established systems. Tradition being one of them, and then everything being optimized to deliver, whether it's education, research, or care in a certain way. We didn't have those constraints. So we could really rethink everything, which is, what our sort of slogan was, not necessarily outwardly facing, but inwardly. And so that was awesome. The first couple years, it sounds like there wasn't anything there. The reality was that's when you have to hire everybody, right? So not everybody, but you have to get a lot of the players on the team. And you're not just creating a medical school to teach people, you're creating a place where people receive care and where research happens in the community. And all of those things are really complex and difficult. When I started, they put us in, they cleaned out the ROTC folks.
Really?
In a building on campus, the Sanchez building, and they cleared out the mock rifles and all of that stuff, and that was our office. And it was fine. I kind of miss it now, in this old building from the 1960s or something. And initially there were 3 of us, and then over those two years, I can't even remember how many we grew to, but we took a series of pictures and of the whole team, and pretty quickly by the end of the 2 years, we couldn't all fit in the same room anymore. And that was wonderful to be a part of that, bringing these people with high aspirations to create a better system all together into Austin, a community that was ready for that. So that part was awesome. I mean, the whole job was really wonderful.
I assume choosing the right staff and bringing people that maybe have spent time with you throughout your career to the Dell Medical School was really, really important too, to kind of launch.
Yeah, so I definitely recruited people that I knew already, some from UCSF, and UCSF kind of got back to me and said, could you please stop doing this?
Can you stop?
Yeah, and I reminded them that it was their job to train people to become leaders all over the country, and they sort of agreed to that, but not really.
Sort of.
Yeah.
Legal probably didn't like that as much.
Yeah, but the... and I can't even tell you how many I recruited from there, but probably close to 10, probably.
Uh-huh.
But and then of course people that I knew nationally, and we got some great leaders from those connections. But some people I didn't know. In fact, ultimately most of the folks I didn't know previously, and they found out about us or we found out about them, and we were able to bring them in.
When was the moment, as you served as dean, that you realized that value-based care really struggled to succeed from inside a traditional system? Maybe it wasn't just at Dell Medical, maybe it's been throughout your career, but I think that's something that's really important to your next level of where you're at Harbor Health today.
Yeah. So let me explain even what value-based care is. So it shouldn't have its own concept like this. When you buy a car, you pay more for a car that works better, that runs better, is more reliable. You're paying more for higher value. If you can get that same car for a lower price, awesome, you got more value in that transaction, right? And if that car costs more and it's the same quality, no, that's not helpful. Our healthcare system doesn't work that way. There's no, pricing related to value, and that already is a problem. But then what that translates to is that no one's focused on constantly improving the quality of the work that we're doing. They say they are, and they are spiritually, they want to be. That's, it's important for everybody in the system to feel that. But the economics don't support that. They don't support the system continuously improving to deliver more health out of it. Really, that's what you want from your health system. More health when you're sick to get better, or more health to prevent you from being sick in the first place. So healthcare value is just trying to get the system to be aligned with our interests from a societal perspective on what we would like to be delivered from the system. The problem is it does require that you get paid differently. You can still do that stuff, and that's actually the way we started in the med school. We just said, screw the payment systems. We're just going to rebuild stuff the way it should be built. And we did that. You can't just boom, do that for everything. So you do it on a condition basis. So knee pain, so we're going to redesign knee pain. Bipolar disorder, we're going to redesign that. Breast cancer, we're going to redesign that. And then you put it back together in a way that where people are healthier and where there's less waste in it. And there's a ton of waste in our system. So you're pulling out the waste. You're not going to pull out something that costs more but gives you good value, that adds to length of life or quality of life.
Sure.
But you're going to pull out the stuff that doesn't. And there's a ton of stuff that doesn't.
Waste, essentially, in the system.
That's waste in the system.
Yeah.
And, the U.S. healthcare system, they say a third of it is waste. I think it's most of the system is waste, actually.
Okay. All
so, right. And it seems to be true because other nationalities spend way less than half of what we do on healthcare, and they live longer and healthier lives. So we're, at least not directing those resources to things that really have impact. So that's what we did. So that's healthcare value. And I was very focused on that as a core notion for the medical school. And those concepts are taught to the medical students, and how do you lead in that, and systems engineering and human-centered design and all these sort of components to allow people to be creators in that system. And it doesn't have to be in that system. They could be doing it in public health or in innovation and technologies or whatever, but being creators, being problem solvers. And then on the research side, part of what you're trying to do there is you're actually saying, we're going to learn to make our own care better. So you're investing in these cycles of research within the organization. And then on the education, on the care delivery side, you're actually delivering those models of care, right? So that is the way musculoskeletal care works today in UT Health Austin, Dell Med. And so that's all wonderful. But the problem we got into was we couldn't get paid for that. So we built these beautiful systems, but they weren't optimized to make money. They were optimized to deliver a better product to society. And even though that product was better, we couldn't get insurers to pay us even to make it break even for those programs. And that, of course, is not the way a free market is supposed to work, right? No. Better products, you should pay more for them. So we tried to sell them directly to employers, and that's really hard because employers don't have the depth of knowledge to understand whether that's a good deal or not a good deal.
No, they're saying, did you raise my rates 10% or 17% this year?
And they can't even know that. They're trusting then a carrier, right, who's an insurer. So once again, you're back to the insurers. And so, and the insurers are, they're doing what they do, but they don't make more money in general by reducing waste in the system, unfortunately. And so that's the extra work that it took to create new payment models for this was just like not worth it to them. And so that was my realization was, okay, this is totally the right thing, creating products, innovating as rapidly as we can to deliver something better to society, for their knee pain, for their bipolar disorder, for their colon cancer, whatever it is. Yeah. But if we can't get it paid for, we can't sustain it, much less scale it. And the whole purpose was to scale it, demonstrate this stuff so that it would get scaled. And so that's when I came to the realization, okay, we can't solve this in the med school. We're not going to be, you really have to own the insurance dollar. You have to own the premium. You have to be the insurer. Yeah. Because then you control the funding. You control the dollars. You control how they're allocated. And then you can build and support the ideal system with those two together. And so that's really what Harbor was about.
Okay. Well, I think about this in my professional life. I spend time around financial literacy, helping teach people about finances and what that looks like and how to go and grow and just the basics. So when I think about this, I almost translate it to medical literacy. And so when I think about that, is that something that the consumers have to think about from their perspective and get more educated, or is it more top down from a company like Harbor to teach us what we're missing?
Yeah, well, from the consumer perspective, there's just no way you can play this game. You get to choose your insurance, and you can do that wisely. Mm-hmm. There's definitely some education that goes into how to choose the right health insurance plan for you. But then you're stuck with it. The plan doesn't tell you what is a good choice or a bad choice, what's a good doctor or not a good doctor. It doesn't even tell you what you might have to pay if you go here versus there. It doesn't give you choices. They're handed to you, and then the next steps are handed to you, and without consideration of cost. If there is a consideration of cost generally in today's system, it's trying to get you to pay more, not less, right? Yeah. And you don't have the controls to pull that back and make a choice that would allow you to save money. And so even when there's a cost share there, which there usually is in insurance, you're not in a position to control it. If you were, that would create a really good pressure to bring down the costs, reduce waste in the system. And if you could also understand quality, which you really can't as a consumer, then that would put more pressure on quality increasing. Yeah. Instead, you're relying on reputation, right? And reputation, if we look at it, because now we have all this data, so we characterize everybody in the state, all the docs in the state. If you look at it, the reputation is mostly about their interpersonal skills. Okay. Yeah, which kind of makes sense.
Yeah, it does.
Because you can see that, but you can't see whether they're actually performing medicine well or doing surgeries well. You don't have the data for that. You don't know whether that's happening or not.
Well, you came from the Dell Medical School. Michael Dell and Jim Breyer both are big investors in Harbor Health. And in fact, you guys just brought in a huge round of fundraising in September. What clicked about the Harbor vision with them, and when did they get involved, and how did they remain involved in the organization?
Yeah, so both of them were involved in Dell Medical School, no surprise. So Michael Dell was involved from the very beginning. So he was, after I was picked to be the dean, I think probably before I moved here, I had a meeting with Michael and his in foundation leadership to discuss my vision for how we would push the school forward. And then he was on my board for the med school. We had a board and a critical member of that board. And so he and I got to know each other quite well. So he understood what it was that we were trying to do. It aspects of it really resonate with him, both as an employer himself, understanding how he's getting poor products and his employees are not getting great care, and access to care, coordination of care, those sorts of things are real issues for him. So he could see it from that perspective. But he also has a real strong tie to what happens to the poor. So how do people without resources or maybe even unemployed, how do they access care? And so, a lot of our work too was with Central Health, the county safety net, to help to provide better plans for care for those folks as well. So that also resonated with him. So he was there from the very beginning. He understood my reasoning for stepping out. He learned about my plans to depart, before my second in command did at the med school. It was important for me to tell him about that and have him understand. And then he's continues to be involved with Harbor as an investor, and he doesn't sit on our board or anything at this point. He's just so busy. But somebody from his team is an observer on our board. And then Jim Breyer was moved to Austin. I'm not quite sure when, 2019 maybe?
Yeah, pretty recently.
Yeah, 2020. And so he became immediately engaged with the medical school in lots of really positive ways, helping to think about innovation and health tech innovation in particular. He's really interested in AI and health. And so, he and I personally started to interact on those things, but also in the programs that we were setting up in the med school to accelerate those things. And he found out, I told him about what we were doing. He was excited about it, and he's been in and quite helpful. He makes lots of connections and has really good insights and has a good sense of where the future is going. And so it's wonderful to engage him in decisions and thinking about how things
incredibly
move.
Bright. Yeah, he is one of the smart billionaire investors out there that's doing incredible things and really on the cutting edge.
Yeah, and Joe Lonsdale ought to be on that list as well. He's another Austin area venture capitalist, and ABC is their firm. They're a big investor. They're actually our biggest investor.
Are they?
And Joe, I wouldn't have started Harbor without him, actually, because again, before I left and announced I was stepping down, I needed to understand, is this something that is tenable? How would it be structured and all that? And Joe was great to talk that through and help me think it through. And he's a character. He's got lots of, his fingers in lots of different things. But he's, he is somebody who really wants to see things work better. And so, that was really his motivation to supporting what we're doing.
So one thing I really find interesting, I spent a little background on me. I'm an entrepreneur. I've done many things, but one of the things I've done is I was CEO of a benefits company. So we did healthcare benefits, went out to employers, and you think about that space, you have fully funded, you have level funded, self-funded, you can talk captives. Harbor's doing something even more unique than that, because you went, hey, we have our clinic, we have our insurance company, we're doing this together. Why do you think vertical integration is so essential to this vision? Because there's not a lot of people out there doing that. How are you pulling this off?
Yeah, it's not easy to pull off because you have to build an insurance company and a multi-specialty care delivery company.
Yeah.
So that just the capital requirement is hard, and the complexity of execution is tremendous. But that's really the only way that we can do what we want to do. It kind of goes back to what we were talking about before. That if we were, my co-founder's an serial insurance entrepreneur, Tony Miller. He created a bunch of very successful insurance innovations that became major products. And most recently, one that got sold to United and is now Surest, which is a plan that kind of uses copay and co-insurance to direct people to the right choices, starting to get at what we were talking about before, give the consumer a signal of where the waste sits and push them away from wasteful decisions and make it financially worth their while to do that. So having somebody on the insurance side, was really important to Harbor. His perspective, why would he want to do this? Well, first, he sold his last company to United, so it was perfect timing, actually. He became available, and he and I had conversations through the years, because he was another one kind of really pushing the envelope of trying to do things a different way. His take on what didn't work in Surest, buying back then, was that they couldn't control what was happening at the care delivery part. So they were directing people to variants of normal care. They weren't pushing the envelope of what care could be. And so he saw this opportunity to push that envelope. That's what he got excited about with what was going on at Dell Med, trying to help us through his insurance, feeding us people and paying us differently. But in this instance, he didn't have that control. Well, I didn't have control of how I was paid. And so it was really bringing those two together that we can create a lot of synergy. And that is what, Harbor's all about, is how to realize that synergy.
One of the things we talked about earlier about medical literacy is the patient behavior and sometimes understanding what to do and where to go. So you're trying to create some kind of bumpers along the lanes of kind of driving where that patient might go with the type of plan they pick, the coverage they get, what that looks like, or provider behavior. I mean, really, when I think about that, what have you learned about both sides now that you're kind of on either side of both the insurance and the care in the first couple of years of doing Harbor?
Yeah, I think insurance is trying to do its job as simply as it can, but it's not using the tools that it has in its hands to help the consumer make better decisions, be healthier, and make decisions. Not use insurance to constrain choice, but allow for choice, but recognize that some choices are better than others, and bad choices should cost more than good choices. So that is really what we're trying to do on the insurance side. That is exactly what docs should partner with people to do, right? They should be helping you make the right choices. The choices should not be cost blind. That was an old conception of how we should practice. If it's cost blind, we're just wasting everybody's money. If I'm ordering a bunch of stuff for you that you don't really need, I didn't necessarily waste your money. I did, probably, because you probably really didn't need those things. But then I've also spent even more of everybody else's money in that insurance plan. So my not managing you well, or letting complications happen or whatever it is, has an implication not just for you but for everybody on the insurance plan, because that elevates costs for everyone. And those costs are real. They're really important. They're growing, and they have a real impact on people's health. Those costs, the costs themselves, impact people's health. So we want the clinicians also to be motivated not to waste. And they have the opposite motivation today, because they usually get paid more if they waste more.
Yeah.
So we, to do that, if you don't want to waste your money, then I'm going to help you to not waste your money. And then you have to have the signals. Both parties have to have those signals. What is waste? What isn't waste? And so then we have to create that operating system that sits on, that gives you a sense where the price makes sense.
Yeah.
The price that you're paying, the price that the insurance is paying, the price that the provider is getting, what you're getting as well. That on the provider side, it's a little more complicated, but you just want to take away their bias to do things that that are not the right thing. You want them to always do the right thing. And right now the biases are towards doing expensive things that aren't necessarily necessary.
Well, I kind of liken this to my time when we talked about benefits with employers, and we'd always say, your employees have to understand that your medical insurance is not an Amex Black Card, right? You get some things, you have some things happen, this happens, and the next thing you go, I hit my deductible, I'm just going to run up the bill as big as I can. I'm going to get 20 things done.
Right.
I think that that's wasteful on the consumer side as well as it's wasteful to the system. And what it does create is higher premiums the next year. So when I think about Harbor and how you're doing things, one of the biggest things I noticed that sets you apart is artificial intelligence and how you're using predictive care. What does that look like, and where do you kind of see the future of AI and what you do?
Yeah, so in what you described as, the deductible too, right, is a silly thing. It keeps you from getting things that you need to get that will make you healthier, that will ultimately save you and society money and the plan money. So deductibles are stupid too. So there's all kinds of like silly things that are built into the way we run insurance today. So why AI? Well, first of all, just to manage a system where we know what those signals are that include cost, it's quite complicated. The costs are hidden, right? So they're hidden from consumers, they're hidden from clinicians on purpose. We ought to, just because they want it to be confusing and hidden, so they don't have to be accountable for cost and waste. And so we have to surface all that. That already is complex. But then we can't just surface all of it. Like a price list for that, if you look at, go online to try to look at prices, they're like totally worthless. For the hospitals are required to post their prices. It doesn't mean anything. It's not going to help you to shop. There's nothing there that'll help you. But how can we then create something that actually does make sense? Okay, you have knee pain. What's it likely to cost all in going to this orthopedic surgeon versus that orthopedic surgeon? We have all that. We can start to share that. But you want to serve that up at the right time and for the right people, right? So you want a system that is interactive, that allows you to anticipate what issues somebody might have and be the first stop for them to help to address those questions, make it super convenient for that. And so that's basically what we're trying to build and are building. We're making good progress. It'll be years before it's a beautiful thing, but already just the first few steps make it way better than what's achievable in the standard system today.
I have to believe that the intellectual property of that data that you're able to start using is going to be possibly useful to other companies and other places along the way.
It is, yeah. And that's been an issue for us. Like, well, how much do we share that, or how much of that is our secret sauce?
Yeah.
But yeah, we've built a whole system to predict, what's going to happen to people. And others have systems like this too. I love ours, though, of course. And then we've integrated that with a system to understand somebody's entire health record and kind of merge those two things together. And then we've merged that with another system that understands context really well. So what is the landscape of all orthopedic care in the Austin Metro? And what's for very specific conditions, for very specific procedures. We have, all that information. And in that you link all that stuff together, you have something really valuable.
One thing that's really valuable that I'm seeing, some of the big changes you're making is expanding to Dallas, San Antonio, El Paso. Really, my question here is, you have big expansion plans, I'm sure. What did you have to get right in Austin before you were able to kind of expand to these other cities?
Yeah, well, we had to understand, build out at least the core for how we were going to provide care. And we had to have enough sort of presence and proof of model to start our insurance company. So the two decisions really came together. It wasn't just, well, now the care model works, let's expand it. It was, now the care model works, okay, now we can start our insurance, because we needed the care to be in place to start the insurance. Mm-hmm. If the two are tied together, no one's going to buy your insurance if there's no place to get care,
exactly.
Right? So you've got to start the care first.
Yeah.
But then once we decided, okay, we're ready to start our insurance, starting insurance is incredibly expensive. And just logistically standing it up is hard, but also you've got to put a bunch of money in the bank. Tens of millions of dollars just sits in the bank account.
Yep.
And so once we had made the decision to do that, then it makes more sense to expand that quickly, on a bigger base. And so that's what led us to do this, this acquisition of Village MD sites and in those 3 other cities, as well as many sites here in Austin. So
Okay.
there's another 10 sites here in Austin, on top of our 12 at the time.
So now that we're talking about sites, I think I want to understand a little bit more for the people listening today that might go, I need healthcare. Maybe I'm not getting it through my employer. Maybe I'm self-employed. What does that look like for that end consumer? Where are they going to find your plans? How does that work?
Yeah. Well, first of all, we take almost all insurance, and we're happy to provide care, even in fee-for-service. It's not our preference. We'd rather you have our insurance.
Okay.
But we'll, and especially for Medicare age too, we're happy to take care of everybody. Medicaid, Medicare, Blue Cross, whatever, it doesn't matter. But we do prefer people be in our insurance because it allows us to create that synergy that I was talking about. And so, yes, we have 2 different plans that are featured right now. One is a plan that's on the ACA marketplace, and it's a cool plan actually. So it's basically the same that we have another one on the employer marketplace where it's for large employers, 50 or more.
Okay.
And that's a fully insured plan you were talking before about.
Yeah.
We want to be fully insured. We can come in lower generally than people are paying through their their
Because you have
self-insured plan.
less middle people, right? You're cutting out some of the waste?
That's right. We're cutting out some of the waste. We're also more actively managing people to take waste out of the care delivery itself. So that's really why that plan. Those same things work in the ACA marketplace. So what that does in the ACA marketplace, it allows us to offer a plan that's not really any more expensive than others, but also has no deductible. And so I mentioned deductibles, like those are just blocking people from doing the things that matter. That has no copays or coinsurance for the things that are launched from your Harbor care provider. So, if you need a knee replacement surgery, even if it's an outpatient surgery, even that can be done without copay. So there's like it's a much better option. People generally will save a lot more in that plan once they're in the plan. So it's basically the same plan that you can get outside the AC marketplace with employers. So it's probably, it's not the typical plan on the AC marketplace. I'll just put it that way.
Yeah.
It's not, we do want people to start their care with us because that's the magic of how it works. But the network is wide open. It's not completely, but we have specialists all over the country, and we just direct people to the best ones.
Kind of imagining what this looks like. So if you don't charge enough for your premiums and you don't have a deductible, then potentially you guys might be losing money on this. And so some of this is building the data and understanding what that looks like.
Exactly.
Try not to make too many mistakes along the path.
That's right. So this is really a complicated calculus, but we are confident that we can offer it for a lower price compared to the value that's received from it, compared to what is normally collected from individuals, because we're confident that we can keep people healthier, and if they're healthier, they don't cost as much, and so that we can pass along to have a richer plan for people. So that's the magic that we're trying to produce. Now, yes, it takes a ton of data to figure that out. Can we afford it? Is that the right price? Are we handing too much back to the consumer? And this is why they make us put all this money in the bank, right, to start an insurance company, because there's risk and there's all kinds of unknowns, right? So if subsidies come through for ACA marketplace plans, many more people will sign up and they'll generally be healthier. Mm-hmm. If the subsidies don't come through, then people who didn't have to pay for insurance before now have to pay $950 a month. That's a huge amount of money.
Yeah.
And those people are going to decide, if they're healthy enough, not to enroll. And so healthy people are going to come out, and the sicker people will be in those plans. And if that happens, everybody who's producing these plans could be in a position where the costs of managing those folks is substantially greater than what they're collecting in premiums. So this is a problem. Anticipating that this might happen led all the plans to elevate their price. So some of this is already built into the pricing increase that was seen this year, but not 100% of it.
So if I understand this right, you're in it for the long haul for multiple reasons. One is an insurance company takes time. You have investors that have invested money that see the future, what this looks like. But from a consumer standpoint, no longer is it, hey, I was at Blue Cross and now I'm at United, now I'm here. You're wanting to get them into Harbor and stay there.
That's correct.
You're trying to build consumers that are there for a long time.
Yeah, so for us, where it really pays off is, we're investing in people being healthier, and those investments cost money in the year that you're making them. Some of them continue out, but some of them are just in that year to get people back to a good state of health. And so we as an insurance plan are investing in those people. They are investing with us, right? They're in our plan, all that. We then want to hold on to them. And so ultimately we're going to try to work on that problem. This is a problem for all insurance. It doesn't make sense that it's an annual thing. Actually, it doesn't make sense that it's tied to employers either. It should be your choice. You should be able to take it where you go, and all of that. And so that's next generation. Is there a product that we can create where we co-invest in you being healthier, and you get credit for that, and that credit accrues to you in the next year, and then the next year, and then the next year. So you keep, you quit smoking, you stay active, you're eating well. That ends up being a benefit to you when you get in a bus wreck 5 years from now or whatever, and then you have more to bring to bear to address that unanticipated problem.
This is crazy talk for the system. I mean, you truly are disrupting in a way that I think most people haven't considered or even thought through.
Yeah, that piece, just let me be clear, is not in this featured plans for this year, but that is something that we hope to introduce in the next version of the plan. Yeah,
I appreciate it. We're going to take a break right now. I hope you're enjoying the conversation with Dr. Clay Johnston. We've gone from his life as becoming in the medical space to an academic researcher to Dell Medical to Harbor Health. Join us after this. We're going to do the Good Hang segment and talk about the future of healthcare.
In every episode of Austin Eras, we uncover the city's history, vibrant present, and bold future. Just like Austin, your financial journey is a story worth crafting. At Collective Advisors, led by Adam Flagg, managing partner, senior wealth advisor, and certified financial planner professional, your story is in skilled hands. From investments to retirement planning, Adam and his team bring together a collective of dependable professionals to help you build, maintain, and enjoy financial security. Start your financial legacy today at collectiveadvisors.com or call 512-467-1923. Investment advisory services offered through CWM LLC, an SEC-registered investment advisor.
Welcome back to the Austin Eras podcast. I have our guest today, Dr. Clay Johnston, the co-founder and chief medical officer of Harbor Health. You've been here since 2014. You've had a little time in Austin. We're going to have a chance to do our Good Hang segment and learn a little bit more about what your life looks like today. I think one of the interesting parts about Austin is it's quirky, right? It's not San Francisco. It's not Boston. What's a weird or quirky Austrian tradition that you hope never fades?
I mean, there are a bunch, but I got to say that Trail of Lights.
Yeah.
It's just this craziest thing, with the little Smurf, exhibits and all these people of all different ages. It's not just kids, and it's not just kids and their parents and grandparents. It's also just like youngsters going and walking the Trail of Lights, and it has it has its beer and food at one section, but it also is very very family oriented. So yeah, I think that's perfect. It's kind of run down a little bit and involves a little exercise. It's outdoors. to me, that's kind of quintessential Austin. And yeah, hopefully it won't lose that kind of small town charm, you know.
I hope not. That is a great tradition, and it's going to be happening as this podcast airs. It can be lines and traffic blocked to get to Zilker.
I know, it's crazy.
It'll be fun.
It does create traffic jams, that's for sure.
So Austin's a music town. We love to talk music on this show. What's an album or artist that reminds you of Austin?
Yeah, I mean, I guess there are a couple. You know, one is this is a strange one. It's just in Macklemore.
Yeah.
And the reason is because when I first came out to Austin, one of the things we did was to put together a playlist for the incoming medical school class, and it had, I think, 2 or 3 Macklemore songs on it, and so I definitely relate that to Austin. Mm-hmm. And the other is probably Lyle Lovett. Yeah. You know, he's just, I mean, I realize he comes here frequently, we'll just put it that way.
He's around all the time.
Yeah, and he's such a good person, and the music is that same kind of combination of traditional and not, you know, and edgy.
It has personality.
Yeah, and sweetness to it, and so, you know, that feels very Austin to me too.
One of the things I read about you is, especially I'm sure in San Francisco, is your interest in fine dining. You'd mentioned Alice Waters as one of your favorite chefs. Authentic Italian pasta. You've obviously probably had some great restaurant experiences here. What are some of your top 3?
I'm not going to give you ones that have been well, I shouldn't say that because then it's not fair to the restaurant. Let me just tell you the ones that are probably, I know, are on other people's lists as well. You know, Locadoro is like a fabulous restaurant, and not everybody knows about it. And you know, it's over in Mueller, and there's that, you know, great pasta and all different kinds of pasta. It's just a wonderful restaurant. Not very creative of me to recommend it, but Uchiko is my other kind of go-to. From the very beginning, coming from San Francisco, Uchiko was just like very natural as a kind of felt like being in San Francisco. There are a lot of I shouldn't say a lot, but there's some restaurants like that, and the Slanted Door is one in San Francisco that's a little like that has that was one of our favorites there. And it's in close to my house, so it's a fun place for us to go for a treat. Mm-hmm. So those two, those
are good.
Enough. Yeah,
those are good. What's the most Austin thing you've ever witnessed? I think Austin just has such a unique personality. What's something strange or different?
Oh gosh, I don't have a good answer to that. I forgot to think about that question.
It's a tough one.
Yeah, I mean, the Trail Lights is definitely one of those that, like, you know. But like an actual act or something that I've seen in Austin.
You probably met Matthew McConaughey or something along the way.
I definitely have met Matthew McConaughey.
That's pretty Austin.
I've definitely met Elon Musk. I've definitely, met these guys. But that's not quintessential Austin. No. Those guys are. John Mackey is also another really interesting, old Austinite and somebody I enjoy spending time with. He taught me a lot about it. This is sort of an Austin observation. Maybe we'll count that. Michael Dell made this observation to me. So, Wheatsville, do you know the grocery store?
Co-op. Mm-hmm.
Yeah, the co-op. And so it's over in our neighborhood too. And Whole Foods, they were actually pretty equivalent. And, Michael was telling me this, when I was in college, they were about the same size and doing the same thing. And look at the differences in trajectory of those two. And one has stayed true to itself and its character. It's still here in Austin, and I know it's trying to expand and it has some trouble. I hope it figures all that stuff out. And, we love it. And then the other just went a whole different direction, right? Yeah. And how did that happen? They were both built on the same initial foundation, and what made that happen? And that's really interesting to think about, why, how did John and company pull that off? you know. And John's take on it was all just a series of rational decisions along the way, and they're just based on principles and doing the right thing at each point. And so maybe that's true. It's really interesting.
I think the principles and vision have to be really reflective of what they wanted.
Yeah.
There's probably a big difference there. But it sounds like you've got to meet some amazing Austinites. What if you could have dinner with any Austinite, living or dead, who would it be and why?
Yeah. Well, Kirk Watson is my buddy.
Yeah.
He was another one before I was announced as the dean that insisted on meeting me. In fact, the UT had forgotten that to make sure that I had a conversation with him, and so we had all set up to make the public disclosure that I'd be taking the job, and he got wind of it, and he insisted that I fly out on a weekend and meet with him, and so we met over at the AT&T Center. He had taken out a room there, and he had a big stack of papers next to him, and he basically had his lawyer hat on, and he was like tested me to see whether I was the right person for this job. And
really?
Did you understand how the medical school started? Let me tell you about the 10 and 10 and all that. And but anyway, it was great. It showed how much he really believed in what it was that we were doing and how invested he was in its success. And so that just started a long-term relationship. I think he's got an impossible job as the mayor of Austin. I think it's always been an impossible job, but particularly today. But I still think having somebody that can kind of very pragmatically and rationally work through things and understand all sides of a perspective and listen to understand and pivot and change, I think that's really strong leadership. That's the kind of the leadership I wish we had more of. I have my own ideological beliefs, but I hope my leaders are flexible in theirs in order to move us forward in a way that aggregates the many voices that exist in this community.
Now we're going to turn to medicine for a couple quick questions, which is, what's a piece of medical advice no one listens to but everyone really should?
Everyone should exercise every day.
Every day.
Yep, not just 3 days a week, not just 5 days a week, every day. It doesn't have to be strenuous. It can be, walking for a half mile, but everyone should exercise every day.
Great. If you weren't in medicine, what other career path would you have pursued?
I was almost an architect. So,
an architect?
I told you I was rebelling a little against following in my dad's footsteps, and so I, as an undergrad, that was a big focus. I decided not to go into physics as a career, but architecture was really interesting. Spent some time studying that before pivoting back.
How involved were you in the buildings as UT Medical went up and your involvement there?
Yeah, some of them were designed before I started, but I was able to get involved towards the end and for all three of the buildings. That was awesome. So, some of the things that were part of the designs, like having no waiting rooms in the clinics, was really an interesting thing to think through and to build to. And I think at least in the way we started was kind of really brought us together about how far we were willing to push innovation.
I want to look to the future now, and really with an eye on Harbor. If you were to evaluate where Harbor is in 2035, 10 years from now, what does success look like beyond your wildest dreams? What has Harbor accomplished in that time?
Yeah, I think if we become, a major player in insurance and care in Texas, that's huge. Texas is huge. I think, care and insurance is more national now, but care is more local, and it's hard to expand that, nor do we need to. If we can create that model of the future for what a better health system can look like, others can copy us in other states, but I think that would be awesome.
I think between your innovator and disruptor kind of views of healthcare and where things go next, I'd love to hear this, especially with AI being involved in your patient data. What will matter enormously in healthcare in the next 5 years that most of us are just overlooking today?
It's definitely true that AI will matter a lot more, and we're not completely thinking about it. I think a lot of people now are using ChatGPT or other chatbots to have medical conversations with.
It's the new WebMD, but maybe more sophisticated?
It is more sophisticated, yeah. And actually they're getting better and better.
Yeah.
It's still not wise to take it directly and implement beyond, like health promotion stuff. But it is, asking more of the right questions, pushing in directions to think about things. All of the core Gen AI models are doing that better and better. They don't know you, so imagine how powerful that would be as if they actually knew you.
Mm-hmm.
And so that's the future state. I don't think it's that far off. We're building to it. We're not the only ones. And so I think it's going to have a key role in the way that we maintain our health.
If you had to give a TED Talk about what's broken in healthcare today and how to fix it, which I think you'd be great for, and I hope you do, what would be your opening line?
Oh, opening line. Maybe the U.S. spends 11 times as much on healthcare as Cuba, and they live longer and have healthier lives.
That's amazing. And if you had to finish out that TED Talk, what would you want people to walk away from when you finish that conversation?
Just that we have the opportunity. It's more the stuff that we've been talking about. We
Yeah.
have the opportunity to really re-envision our system and reallocate our resources to be healthier and to continuously innovate that system so that it's always pushing the envelope on what it means to be healthier.
I love it. Last question is, if you had to step back from the front lines, you've been in leadership and you'll continue to be in leadership for the foreseeable future, how would you spend your time, and how do you want to be remembered in your impact in healthcare overall?
I don't want it to be about me.
Great.
Yeah, I think I'd love for the system to succeed, and it doesn't need a person attached to it. That I do think it needs leaders to step up and to take risks and to be accountable to some extent. And it needs those leaders because it needs, that's part of the way change happens. So I recognize that that's really important. I don't have to be that leader, the one that's the face of it at all, but I'd love to see it actually happen.
I love that. I think that the disruption in healthcare a lot of times is about risk, and what I see in healthcare at this point, and I think you wrote about this, that the medical handbook, a lot of the things that we still use, a lot of times those things were built 100 years ago, the direction of care and where things are. So what I don't see in healthcare, and what you're bringing to the table with Harbor, is taking risk and challenging things beyond just the academic research side of things.
That's right. I mean, the system is constantly improving, taking some risks, but around a specific drug or a specific device or specific surgery or whatever. But no, we're trying to change the system itself, fundamentally how the system works and what it cares about. And we're trying to get what it cares about more aligned with what we as people should want from the system.
Thank you so much for joining us. Dr. Clay Johnston, the co-founder, chief medical officer of Harbor Health. You've been a great guest on Austin Eras. We hope that everyone tunes in to our podcast, whatever platform that you find it. Find more information about Harbor Health at harborhealth.com. If you have a future guest suggestion or want to drop us a note, Adam at austineras.com, or our showrunner, Mel at austineras.com. Thanks for listening. We'll see you next time.
Austin Eras, featuring Adam Flagg, is brought to you by Collective Advisors. Collective Advisors offers investment advisory services through CWM LLC, an SEC-registered investment advisor. Guests on Austin Eras are not affiliates of CWM LLC, and opinions expressed by guests may not reflect those of CWM LLC. This show is intended for educational and entertainment purposes and is not intended to provide specific legal, tax, or other professional advice. For a comprehensive review of your personal situation, always consult with a qualified professional.